It is my honor to be with you here today. We are 9 months into the worst pandemic in a century. More than 1 million people around the world and more than 200,000 Americans have succumbed to this disease. While we have identified a series of public health measures and therapies that, if used effectively, can keep the disease at bay, in order to bring the pandemic under control, we will need safe and effective vaccines. Now, while it usually takes years, often decades, to build a vaccine, unprecedented collaboration among the global scientific community means we have multiple candidates in phase 3 trials just 9 months after we identified the virus. This is incredible progress. But here's the problem. While the process so far has been carried out with great scientific integrity, as we near the end zone, we need to ensure we don't fumble the ball. We have seen large declines in Americans' willingness to get a vaccine. And if we fumble the ball, the cost to our lives and to our treasures will be enormous. And so, as has been already stated, here is the key point. We need to ensure that we have vaccines that are safe and effective and perceived to be so by the American people. So why are Americans worried? They're worried because of the politicization of the scientific federal agencies like the FDA. Whether it was the emergency use authorization of hydroxychloroquine or the unfortunate hyping of convalescent plasma, physicians and nurses and the American people increasingly worry about the integrity of the FDA decision-making process. The decision to issue an EUA for a vaccine must be based on scientific timetable, not on a political one. And the unease has grown recently as the Pfizer CEO has repeatedly suggested that he is moving to get their vaccine out before the election. This, on top of the landscape of vocal, science-denying anti-vaxxers, has created a dangerous situation that, if allowed to fester, could cause loss of faith in vaccines for years. We must not let this happen. I believe there are 3 things we must do. First, we must let pre-specified scientific standards drive whether a vaccine receives an EUA or not. Last week, FDA scientists put out guidance about the requisite follow-up time period and the impact of any vaccine on disease severity. These are right, and they are a minimum. And we must ensure that we let FDA use their standards for an EUA approval. Second, we need a lot more transparency in the process. While I was heartened to see vaccine companies make their protocols public, we need more transparency about safety signals in their trials and how they are addressing them. Unprecedented times like these call for unprecedented transparency. And finally, it is critical that when an EUA is issued by the FDA, we hear directly from the great career scientists at the agency. This will assure the American people that science is driving this process, not politics. These are critical steps, but they alone will not be enough. We need a strong communication plan that engages with clinical and public health leaders, religious leaders, and others about the process. Americans will turn to these individuals to get advice. Next, we need a plan for a fair distribution. This is a source of immense concern for many Americans. We cannot repeat the mistakes we are making with testing, where the well-connected are able to get tested on a regular basis, but regular testing is not available for school teachers and nurses and first responders. We need to ensure that vaccines are available for all of us, not just those who are well-connected. And finally, we need to eliminate all financial barriers to getting vaccinated. 1 in 3 Americans report that they will skip the vaccine because of financial concerns. We can't possibly let this be the case. 2020 has been a very hard year for all of us. 2021 can be better. In order to get some semblance of a new normal, we need a vast majority of Americans to get vaccinated with a safe and effective vaccine. The vaccine development process so far has been done with great scientific credibility. It's now time to let science finish the job. And let's use good science communication to help people understand the integrity of the scientific process, and let's eliminate financial barriers and implement smart distribution plans to ensure that we can turn vaccines into vaccinations. If we do all of that, we can finally bring the pandemic under control, heal our economy, and let Americans get back to their lives. Thank you.
Thank you so much, Dr. Jean. Thank you to all of our panelists for your excellent